Hello, and thanks for joining us for Staffing Unplugged, a medical solutions podcast where we delve into the world of healthcare staffing, workforce solutions, and everything in between. If you're a healthcare leader navigating workforce shortages, recruitment hurdles, and retention struggles, you're in the right place. Each episode, we bring in industry experts to share insights, strategies, and success stories. I'm Kristen Dahl, your host, and today I'm joined by two incredible guests. Patti Artley, Chief Nursing and Chief Clinical Officer at Medical Solutions, and Ron Hoppe, CEO of WorldWide Healthstaff Solutions, a medical solutions company. Patti, Ron, thanks for being here
You're
today.
Happy
welcome.
to be here.
Well, we are tackling a big topic today. How can hospitals and healthcare organizations rethink staffing to build a stronger, more sustainable workforce? With budget pressures, staffing shortages, and burnout at an all time high, leaders are being asked to do more with less. So today we're breaking down three key strategies that can help: flexibility, international hiring, and virtual care. Let's start with the reality on the ground. We all know hospitals are struggling to keep up with staffing demands. Patti, Ron, why is it so important right now to think outside of the box when it comes to workforce strategy?
Well, I think you mentioned, Kristen, the fact that budget pressures are on for everyone. We have limited resources, and that requires us to be strategic and intentional with all of our investments. And really investing in our workforce is what is most important for the success of our organization. And when you understand what is happening in your environment, you can invest in the retention pieces, which are so critical to your success. And one thing that we know is that we can't do the same thing that we've always done and be successful now.
When I think of flexibility in the workforce, the thought that comes to mind is having choices. And when we talk about thinking outside of the box, we want to be maximizing the choices that we have. And I think to do that holistically, when it comes to just workforce overall and flexibility specifically, I think it's important to have a correct understanding of what the challenge at hand is. Certainly filling shifts day to day is a challenge, but in order to obtain the type of flexibility that's needed, I think it's important to understand that the root issue that's being dealt with here, is needing to be dealt with, is one of supply and demand. Right? If we take all available qualified clinicians, registered nurses, and line them up against all open positions, there's a gap. And I think understanding the challenge from a supply and demand perspective will cause us to look at it slightly different than if we're just considering it to be another recruitment problem.
One of the biggest pain points that we hear from hospital leaders is retention. It's not just about filling roles, it's also about keeping great talent in your organization and honestly in the profession. One thing we talk a lot about is workforce flexibility. Patti, what are some ways hospitals can use flexibility to improve retention and keep staff engaged for the long haul?
Sure, flexibility is critical right now. When we think about what our Gen Zs and millennial staff are telling us, and then in addition to that, some of our individuals that are more in my age group and really thinking about how hard it is to work 12-hour shifts, it requires us to really step outside the box and think creatively. And one of the things that I have to say is exploring creative scheduling and how we staff using resource pools, considering weekend options. I know that sometimes because they're a little bit more pricey, we back away from them. But when you think about being creative and looking at different options, it's going to make you very successful because that's what our staff are looking for. And one of the things I always tell people is start with your data because what's happening in one hospital is not happening in another. And it's important to know your demographics. Where is your turnover happening? What's the age of your workforce? And then you'll look at that and develop the right strategies. One of the things that I see very successful right now is leveraging 8 hour shifts, looking at where your biggest churn is at. And this is very successful in keeping your seasoned staff. When you think about how difficult it is to work 12-hour shifts and all of the complexities that happen there, that's something that I see, that whether it's a 4 hour shift or an 8 hour shift, that makes it very successful in retaining some of the staff. And one of the other things that I see is the virtual nursing, whether you are using it today or something that you're inquiring about. But this has really become very popular in trying to think about flexibility and retaining staff at the bedside. And it really helps with some of our novice nurses, really keeping them, having them a resource and keeping them at the bedside because they feel supported. And it's another option for our seasoned staff. So those are a few of the strategies that I see being deployed across the nation.
Yeah, absolutely. All great information. Ron, as a staffing and workforce solutions veteran yourself, I'm interested in your thoughts on flexibility as
Yeah.
well.
Specifically from an employer's perspective, when I think about flexibility, again, it's about choice, and I think a key strategy to ensuring that you have maximum flexibility as an employer is to first focus on your core staffing and optimizing your core staff. If you've got that in order, then you start to have a lot more options and you can be a lot more creative because you're not focused on constantly battling or constantly trying to keep up with issues from day to day. So I think that's certainly a very key element. And then, as we said at the outset, again, thinking creatively, thinking outside of the box, and being open to seriously evaluating something like international recruitment that we'll talk about more shortly as a possible strategy or part of a strategy that's going to put you in a place where you will have maximum flexibility and options available to you.
And Patty, back to you again. Do you have any examples of hospitals that have successfully used flexible staffing to improve retention? And what can other leaders learn from those experiences?
Sure. We work with a lot of clients today that are really on this journey to create the flexible staffing. But one that I saw was really successful is in Oregon. They know that they wanted to get out ahead of some of the legislative requirements that were in place for Oregon for 2025. And so about a year ago, they embarked on a opportunity to think about how to staff breaks and meals to make sure that the ratios were maintained. And that's what the new legislature is really pushing towards. And so they introduced staff shifts from 11 a.m. to 3 p.m. And then they did the same from, I think it was 5 to 9 when they started. They tweaked those hours using their data and really looking at where their movement was. But they were very creative so that they could create flexibility around lunch and dinner coverage. And the way they really drove those 4 hour shifts was instrumental in making sure that their coverage model was there. And they started out by unit based and really moved it into a more flexible model by creating those shifts in the float pool as well. And really offering those 4 hour shifts, which then they also offered 8 hour shifts in between to help with that kind of coverage. They really broke away from that every shift has to be a 12-hour shift, but it helped with nurse satisfaction and it ultimately helped them with retention.
Another major strategy that's making a big impact is direct hire international recruitment. Ron, this is your world. Can you break down how hospitals can integrate international hiring to fill gaps and bring stability to their teams?
So, as I mentioned before, it's important to understand that the reality that healthcare providers face in America, as it relates to their nursing workforce in particular, is they are facing a supply and demand challenge. Obviously, the first response that one would come up with, it would be for the education system to produce additional or greater numbers of new graduates. That's already happening. The US in recent years has graduated more new registered nurses than ever before. We've been talking about this for the last 20 years, and yet the hole is getting deeper in terms of supply demand imbalance. International recruitment, more specifically direct hire international recruitment, can play a very significant role in a medium and longer term staffing strategy, in that it is one of the few levers that employers have to add to the absolute supply within the workforce. So I think this is a very, very important consideration. The international workforce, when it comes to registered nurses, it's also really important to understand that we're not just talking about another person or another body to fill a position. The typical international candidate arrives in the US with anywhere between 4 and 10 years of experience on average. And that valuable experience is exactly what US employers are in most desperate need of. So, international recruitment, specifically direct hire international recruitment, is a significant strategy to address the supply demand imbalance. It's also a significant strategy to combat what is known as the experience complexity gap, where we have an ever more novice nursing workforce at the same time that we have patients in our hospitals and nursing homes whose needs are more complex than ever before.
Patti, as a nurse and nurse leader yourself for many years, have you been on units where international healthcare professionals are contributing? And if so, can you tell us what other advantages there are for including international professionals on your team?
Sure. I've always been a strong proponent of international nursing. They have always brought a strong dedication to the organization and the unit that they're working with, and the individuals. They're a great member of the team, and their work ethic, I think, is hard to beat. But truly, they have been instrumental in providing a different kind of experience. They bring a unique perspective that's different than what most of the graduates that come out can really learn from, and it diversifies your entire workforce. Many of them, as Ron had alluded to, have 4, 5, 10 years of nursing when they're coming here, which really does help bridge that experience complexity gap. Our academic partners have been great in really stepping up to the plate and producing more nurses because of their ability to expand the clinical resources, and their partnerships have been absolutely wonderful. But this really helped our novice nurses grow and develop by really helping them think differently. They share their expertise. They are highly technical. And I know that in my last organization that I worked, we had this as part of our long term strategy for medical surgical nursing and our dialysis unit. And we continued to hire them quarter over quarter, knowing that we would then have that where our highest churn was, we were able to have experienced nurses in those areas.
And you've both mentioned the experience complexity gap. So let's spend a couple of minutes talking more about that. With seasoned nurses retiring and patient needs becoming more complex, newer clinicians are stepping into high stakes environments with less hands on experience. So, Ron, talk a little bit more about how international hiring can help when it comes to that
Sure.
issue.
First, let me just kind of um, paint a little clearer picture of just how significant of an issue this is. Scholarly research that was completed, I believe, in 2018, 2019, um, indicated that the US nursing workforce would be losing 2 million person years of experience each year from 2020 to 2030. That is a staggering number that's almost hard to comprehend. The cumulative effect over 10 years is 20 million person years of experience leaving the workforce at the same time where patients' needs are more complex, are of greater acuity, and individuals are requiring care many times over extended period of time. So just not to put too fine of a point on this, but this is not a minor issue when it comes to the delivery of high quality healthcare services, which of course is a high priority for every provider. As I've mentioned, the international nurse doesn't just provide another body or another set of hands. They're coming with experience, many times working in other developed countries around the world, sometimes even in workplace environments that are even as advanced or more advanced than the work setting they relocate to when they arrive here in the United States. We have employers that routinely will find that if they are hiring 50 or 100 international nurses and they do a survey of the average years of experience, they would very regularly find that at the time of interview, that individual has somewhere between 7 and 8 years of experience on average, which means by the time they arrive in the US, they're going to have 8 or 9 years of experience. I think it's really, from a patient perspective, this is a critically important issue. And from a HR talent acquisition perspective, it's also critical to fully understand what is happening. If I'm working in a recruitment office or in a talent acquisition office, and I get a spreadsheet report at the end of the day on Friday that says this week 3 nurses left, but we hired 3 to replace them, it would be easy to conclude we lost 3, we hired 3, we're good. When in reality, what likely has happened is you've probably lost 3 nurses that are very well tenured, maybe 20, 25 years of experience. And most commonly, they will have been replaced with nurses that are far closer to the front end of their career. So while on a spreadsheet it says we hired 3, we lost 3, in reality, you may have lost 50 or 60 years of nursing experience, which has a cumulative effect that can be devastating. And international recruitment very, very directly addresses this issue. And it does so with the international candidate who comes with 7 or 8 or 6 or 5 years of experience and is still very much in the front half of their career. They still have a lot to offer.
Wow, yeah, shocking numbers that you brought up. Thank you so much for that information. That's really kind of eye-opening, I hope, for all of our listeners out there that are tuning in. Um, Patti, Ron discussed international recruitment as a kind of a way to remedy the experience complexity gap, but are there any other ways to take on the experience complexity gap?
Sure. I think one of the most common right now and most popular is really that virtual nursing that we're seeing. When we think about the challenges, having the seasoned nurse replaced by a novice nurse, it really does give us that little bit of flexibility when you think about how demanding it is to work through that 12-hour shift, as we talked about. This provides a different option. So it allows seasoned nurses to stay in the nursing profession for a longer period of time. They provide a resource to nurses that are at the bedside and really does extend your workforce. So I see that very often happening. We talked about flexibility, and when you've created some flexible opportunities, There are several organizations that are doing the We Want You Back campaigns and really targeting those experienced nurses that have left the workforce. And this allows them to offer them other options other than those 12-hour shifts, having them come back for 4 hours, for 8-hour shifts, to act as a virtual nurse and help really remove a lot of the tasks or help the nurse practice to the top of their license. These are some of the things that as nurses are getting more creative, they're really thinking through how can we leverage and extend how long we have our nurses at the bedside or how long we have them in the profession, and really giving them meaningful ways to contribute to our profession.
And you did mention virtual nursing. I wanted to ask you about that. Can you explain what you're seeing in terms of how virtual nursing is playing out in the real world?
Sure. If I had 10 different virtual nursing programs, I'd have 10 different ways of doing it. One of the things that we are seeing right now is there is an evolution of trying to create some standard guidance on virtual nursing. And what really defines that virtual nurse is rapidly evolving. As we're speaking, there are more virtual platforms that are out there that are providing different technologies to be utilized, and that's changing every day. And really, the professional organizations are offering new certifications to really expand. They recognize that virtual nursing is so important to us as we provide care and think about different ways to provide care. So I think that we'll see a lot of that evolving over the next few years. But when I look at how a lot of our partners are utilizing that, they are using them in critical roles, letting them really evolve to help the nurse at the bedside, and they are part of that integrated care model, where they're part of the team that's providing admissions, discharges, teaching, and helping them with second sets of eyes, whether it's for quality indicators or whether it's for second dose checking. And then we have EICUs, where we're seeing larger hospitals of the systems being able to provide that ICU support and support for rapid teams so that they're making sure to keep um, their patients safe. And what it's doing for both organizations is really a huge win for hospitals and the patients, because we're keeping patients closer in their community and allowing them to be closer to their families and still providing very safe care for them. So, really enhancing the care that they're able to provide at the community hospital. And I really think that we're going to see a lot more innovation, a lot more of the AI being leveraged here, and that'll help us be even quicker and smarter as this evolution takes place. We're seeing a lot of economy of scale on virtual sitting. Once the patient, while they still may need monitoring, but might not need that elbow to elbow support, in helping just provide that extra layer of support. And that's really an economy of scale, keeping them safe so that you reduce falls and all of the other patient safety opportunities by really making sure that the patient is safe, but in a more effective and a cost efficient way. And what that does at all avenues is really vital to support the nurse at the bedside. And when we're thinking about retention strategies, this is a critical element for organizations. And that's why I say thinking outside the box and not necessarily thinking about the actual ratios, but thinking about how you can provide care differently.
Yeah, absolutely. Out of the box. That was what I was thinking the whole time you were talking. Really taking that out of the box thinking and maximizing that sounds like what you were covering. So, Ron, I'm also curious about your thoughts in terms of virtual care and healthcare. What are you seeing?
Yeah, so I think there's just tremendous opportunity as has already been described, and I'm really excited to think through and to start to bring to market um, the contributions that the international workforce can make in this area of virtual health as well. Virtual health in some respects is something that is relatively new, relatively recent, and it's attractive to certain workers in the healthcare system. But employers are already finding in some cases that they're having the same challenges in staffing their virtual programs as they are in staffing their ongoing operations. This is particularly true at the present time in the area of virtual patient sitting. And given, the acceptance of remote work and the acceptance and development of new technologies, we're excited to see how it is that patient sitting, virtual patient sitting here in the US can be very well supported, safely, effectively, efficiently supported by a workforce that's actually outside of the United States. And I think, when we really think through again the reality that US healthcare employers face, virtual is key. And I would put an even finer point on it by simply recapping, I think, the whole thesis for virtual health and how international workforce can support that is by just recognizing again that we have a long-standing workforce shortage that's going to be with us for the foreseeable future. The U.S. healthcare system, the U.S. education system has not kept up in terms of putting out the number of graduates, and we're now for the first time facing in America a decline in college and university enrollment, which is only going to make that aspect of generating new grads more difficult over time. International recruitment provides a great solution, but the reality is there's a limited number of international workers that can come to the US in a given year, given the current US immigration system. So that means there's a limited number of workers that we can bring here to where the work is. So then the next approach logically is, what work are we doing here today that with technology we can safely take to where the workers are? Today, that's virtual patient sitting. And I think in the near future, we're going to see that roll out to various other uh, clinical applications that will have a registered nursing component to it, other administrative components to it. And I think it's going to be a significant contributing factor to employers being able to provide high quality services with a high quality workforce, given the domestic shortages that we're going to be facing for the foreseeable future.
Very exciting stuff. Very exciting solutions to some of the problems that we've all been experiencing for a while now. So, thank you for sharing that. So, we've covered flexibility, international hiring, and virtual care, three powerful strategies for tackling today's workforce challenges. As we wrap up, I want to ask both of you, if there's one key takeaway for healthcare leaders, what would it be? And Patti, I'll have you go first.
Well, I think I'd have to say you have to be creative and willing to innovate. When you're open to new ideas and not just thinking about how we've always done it in the past, it truly will make a difference in retention and most critical, the quality outcomes for your patients. And when you think about being adaptable and really embracing the opportunities that are in front of you, I think you'll be more successful in overcoming the workforce challenges that we have in front of us.
And Ron, same question for you.
Yeah, I think you know the key takeaway that I would hope is taken from today's conversation would be this understanding of viewing these new ideas, innovative ideas, out of the box ideas, that they are considered in the context of trying to solve a supply and demand problem, because ultimately that is the challenge at hand. And innovation is not optional. It's absolutely essential, I think, for survival, and certainly to have any opportunity to provide high quality care. Supply and demand, the principles are really pretty simple, right? No health system is having a meeting today to discuss how they might decrease the demand for their services. So the demand side is only going in one direction, which means we have to be thinking clearly about the supply side. We do need to educate as many graduates here in the US as is possible without diminishing the standards of education and the benchmarks that we have for particularly professional staff such as nurses. That absolutely is a must. Various other retention strategies can have some impact as well, but there's no retention strategy that's going to have the 64-year-old nurse stay until they're 72, just to be real about it. So international recruitment is one of the few practical strategies available now to significantly add to the supply side of the equation, as opposed to simply moving registered nurses from one employer to the next who may have a higher sign-on bonus this month, only to have them move back again 12 months to another employer because they now have some bright shiny new program that is attractive in the moment. So that would be my one key takeaway, Kristen, is just to evaluate all these potential solutions that we've discussed today in the context of trying to solve a supply and demand problem.
Very well put. Patti, Ron, this has been such a great conversation. Thank you both for joining me today and sharing your insights and expertise with us.
It's been
You're
a
very
privilege.
welcome. Thanks
Thank
for
you.
having us.
And thank you to all of our listeners for tuning in. If you found today's discussion helpful, be sure to join us next time as we keep diving into the latest trends and workforce solutions in healthcare staffing. For more information, check out medicalsolutions.com. Thanks for listening, and we'll see you next time on Staffing Unplugged.